So we've had a number of questions from people asking whether they should inform their WM healthcare team if they have had COVID or are diagnosed with COVID. What would you recommend on that, Shirley?
So at the moment, the way testing is done is somewhat variable. In hospitals, there's a lot of screening for COVID positivity, but patients may be completely well. That will help the teams looking after them to look after them in certain areas within the hospital. I'm less familiar, to be honest, with what's happening in the community in terms of GP screening or community-based screening. I would say, as a general point, of course, the specialist would be interested to know if there is COVID positivity, but I think that the context is important. If you are unwell with a positive COVID test, then I think it is worth consulting with your specialist, because there may be implications for you as someone with WM. There may be implications for where you are in your treatment cycle, or just advice that can be given to the other doctors looking after you. I think, however, if you happen to be positive but are asymptomatic, I don't think there's a specific need to reach out to your WM consultant, because, to be perfectly honest, there's no way of really tabling all that data in a meaningful way. It is of general interest, but the key thing is for us to be aware in case there's a deterioration of health. Then we would generally want to act quickly on looking after the individual, because what is true is that anyone who develops COVID, some of the early studies show that early hospitalization is important, early oxygenation is important, and supportive care, treatment of dehydration. So I think if you're completely well with a positive test, wait and see. If you are feeling unwell and getting worse, then please do get in touch, because I think then your hematologist will hopefully be able to help you get the care you need.
Shirley, just to add to that, is it fair to say that if nothing else, at least being able to consider going on one of the clinical trials around people who've had COVID-19, and obviously adding to the wider body of knowledge of the impact of that on WM and lymphoma is something that the more people we have who've had COVID as well as lymphoma, the more that helps other people further down the line.
Yeah, I think in general that is certainly the case. To my knowledge, the trials that are being offered at the moment are really for, as far as I'm aware, people who are admitted, because there needs to be somewhat of a screening process involved with bloods and certain assessments, x-rays and imaging and so on. But it may be, things may change, and there may be other trials coming through where the net is widened, and I think more knowledge and more the bigger pool of people we have to participate in those trials, the better.